I was just listening into the last session, and I found it really interesting. And I think Professor Director Sidnath Dev has correctly placed my session after that session, because that session was talking a lot about ethics and justice and so moral issues. And when we talk about rights, it is the same framework. It is just another lens that we take, looking at the same framework. Because here we are talking about the people who have the rights, so that they are able to enjoy their rights in order to live life peacefully. So this is again, why it is important, because once one person's rights cannot overlap on another person's rights. It is in the stories that the earlier session resource person was talking. They were all individualistic focus. So we were, thinking about one person's right, one person's morality, one person's ethics, etc. But here we are seeing a macrocosmic view of the same framework, and talk about everybody's rights, especially focusing on children, adolescents, and young people. So that is the background with which I want to present to you how these rights of the children are generally viewed, and how they have been, going through a difficult patch during the COVID time, when we know that a lot of things are going through a difficult patch for the lives of people. Livelihoods have been lost, so all of that. So I'm just going to take you through in a more generic way, and then we will focus more on how we can work, how the NCC officers can work with adolescent and young people in this context. So that is going to be the structure of my presentation. In the first slide, I have about 20 slides, so bear with me. I will try to be quick, but if you have any burning questions about the slide, you can feel free to stop me and ask me a question. Okay. In the first slide, just to make it clear for you, we are talking about the rights of children, which means anybody who is in the womb of a mother. Say, we sometimes say, minus 9 months, because only at the third month or so that a life is there. So starting from there until 18 years of age is defined as a child. And these children, that is the children up to 18 years of age, they have a right to childhood, which means they have a right to education, they have a right to be healthy, they have to be, they have a right to be heard of their opinions and voices, they have a right to be treated fairly, etc., etc. So what we do is we combine all of these into four major rights under the United Nations Convention of the Rights of the Child, where we talk about right of survival, right of development, right of participation, and right to protection. So that is what this slide is telling you, how several factors in our society shape the rights of the child. To just take one example, if you're going to talk about the demographic, factor that I've put in there, old people and young people, and all of them have a certain impact on a child. How we treat our child with respect. Do we take our children at the right time for medical care? Do we provide education for the child? All of this is decided by the demographic factors of a population, because if there is an older population, there will be, the government may be spending more for older population and not the younger population. If there are very few children in a society, sometimes there may be more focus on those few children, because whatever you do for those few children will have a larger benefit over time. So it depends on how a government looks at it. These factors will affect the rights of the child. In the um, next slide please. Are you able to follow me? Can I go in the same pace, or do you want me to talk slower or faster? Anybody can give me
slower, ma'am. Little slower.
Little slower. Okay. Okay.
Yes, ma'am.
As madam the training tawri cutting a lorry. I call ko. Chatan online class only no more call ko. Madam na 100 training tawri se 31 pound of class and telo river ko. Ado kang bra. Madam ki mobile se no ngala patagi online class.
Ms. Sujata, can you please unmute yourself?
India da IPS officer kya lekhang bana.
Ms. Sujata, please unmute yourself.
All India given IPS officer kya le. Do jike ni hang. I hang is. Come. Ado kaino ni khang bra. Madam ki mobile se pokhai do re online.
Can I go ahead? Just try to focus on my voice. There's another voice. Okay, thank you. So, you know, in when we are talking about those different child rights, there are different ways of measuring whether the child rights is realized or not by various countries. So in that, there are various approaches, and one of the approaches which I personally, agree with is a multi-dimensional poverty approach, where we look at the health status, the education status, and the living standard status of the child, and then, give a measure to it. Why do we do it? Because we can compare across countries. When we are doing global development work, we try to get a measure so that we are able to say that, okay, these countries where the child rights are, really not realized, and, there are a lot of problems, say, with reference to children are not going to school, or many children are dying, or children do not have safe drinking water. So depending on some of these factors, we measure the child and then focus more attention on those countries. If you see, even within India, you will see that, there are at least 31 out of our 600 and odd districts, which are acutely poor, which means we need to do a lot of work in those 30 districts where children are acutely poor. And even globally, if you see, 1 in 3 children are multidimensionally poor, which means that, they are affected by health, they are affected by education, their living standards are poor. So they need our support as duty bearers. Whenever we talk about rights, we also talk about duty bearers. If a child's right has to be respected, if a child right has to be realized, then all of us as duty bearers will have to, work for the child. It is our duty to work for the child, and not just because, from a welfare point of view, a child has to be helped. It is our duty to help children. So in this, when you see COVID-19, one of the studies very recently done by my organization UNICEF and Save the Children, we released it last month, and it showed that, while children were already multidimensionally poor in India, by 15 percent points, this multidimensional poverty has increased because of COVID. Next slide, please. So I'm just going to look at, how COVID has affected in the next slide. I'm talking about the well-being, the child well-being during COVID. We know that, when the most of the impact of COVID that we have heard is all about health, right? Which is very important, that how many cases, how many have died, how many positive cases are increasing every day, and all of that, how the curve is increasing in several places, your city, your town, all of that. We have gone into the granularity of data about health data around COVID. But this COVID has also had a secondary impact on children and women, because for example, if you looked at the reverse migration that happened, which I'm sure the Northeast is very familiar with it, because several of the people who had gone out of Northeast for work, they were coming back due to fear and anxiety during COVID time. So we saw that 500 to 600,000 migrants were just walking barefoot across the country. 750,000 of them where they were using the trains and buses, because 118 million job losses were recorded. And these job losses, you would appreciate, are in the non-formal sector or the informal sector, where anyway we do not have very good job records or enrollment records. So we presume that so many more people lost their jobs, and it was a really difficult situation for so many families. So in this context, obviously you can understand that women and child rights, especially because they are more vulnerable and they are more weaker in many ways, their rights were affected. We saw, community feeding centers were started, and several schemes were in place. The ration cards provided them more supplies. All of that happened. So we are all familiar with this context, but I just wanted to highlight that context a little bit before I go to each of the sectors in my continuing slides. In the very next slide, I'm talking about COVID and child health. The next slide is on COVID and child health to show that, how the health of the child was affected. Next slide, please. Next slide, please. Yes, thank you. So in this, when you talk about child health in India, uh, even in normal times, I'm saying, for every 1,000 children who are born, 33 children die. 33 infants die at the time of birth. And when we talk about children under the age of 5 years, 37 out of every 1,000 children do not see their birthdays. So this is the status in normal times. And we have routine life-saving immunization services, etc., which are provided for children by the country. But one dipstick study that, dipstick in the sense, just a very rapid sort of a survey study with few samples, found that, in Rajasthan, and then it was extrapolated to the whole country, it said that maybe 5 million infants may die more because of COVID, because we are not able to provide them immunization services. Now, in that other example of the last session, you were all discussing about the child, on the railway track path, and you were saying that, oh, that's an innocent child. In fact, all are innocent children and they should not die. Just imagine so many more innocent children, 5 million children may die because of, the immunization services are affected or disturbed because of COVID. So what is the response? Of course, the government of India has got this Mission Indradhanush, which is a program done in 2014. It's a scheme to basically accelerate the number of immunizations. Because what does immunization do? It provides vaccines in the body that can fight and save the child from diseases. So by this, approximately, it's a very big program called Mission Indradhanush, because of which 27 million newborns are immunized across the country. There are several other activities that happen in the village level, which is like the village health and sanitation days that are celebrated in the sense, during which time the drive for immunization is given. Health workers act like foot soldiers. So this is the response for COVID in terms of protecting the child right to health. In my next slide, I'm talking about the child and nutrition. The next slide is on child and nutrition, in which, can you please change the slide? So in this slide, I'm talking about how the child's right to food and proper growth according to the age is affected. That is when we say that the child right to nutrition is affected. So in India, if you see in normal, by the latest data, even before COVID, we found that 20 million children under the age of 5 years were suffering from wasting, which means, they were too thin for their height, and 40 million children were chronically malnourished, which means that they were underweight, and 38% of India's under 5 children are stunted. Stunting means they are too short for their age. They have not grown enough for their age. And this stunting normally, sets within the first 3 years of a child. And if you don't correct it within those 3 years, you can never correct it. You would be able to see as adults also, there are some very short people, right? probably they could have grown better if only their nutritional feeding practices were better when they were less than 3 years old. Not only by height, even by in terms of the intellectual growth, the brain growth, which happens maximum during the first 1,000 days of a child, that gets affected when proper feeding practices are not given to the child. Now it's a right of every child to be properly fed. But because some people have not been able to do that, perhaps due to poverty, perhaps due to wrong practices, perhaps due to lack of information and knowledge, so many children are affected in their right to nutrition. So this is Indian standard even before COVID, and because of COVID, it is said that 10 to 20% of malnutrition may increase. That is 10 to 20% more children may become malnourished because of COVID. Because as you know, not only have parents lost their jobs, the food supply chain was affected. That trucks and lorries were not able to transport food for so many months. There is a lot of disruption in life, and this is affecting the child right to nutrition. As a response, yes, Government of India has this program called Poshan Abhiyan. We have been celebrating National Nutrition Days. We have been, highlighting the need for providing proper nutrition not only to the mother, but also to the child, but also to the lactating mother. And you must be knowing some of these programs yourselves. And even the Supreme Court said that even if schools are closed and if the Anganwadis are closed, the midday meals should be delivered as dry rations to the children at home. I will come back to all of these points when we talk about, how NCC or other student cadets can actually contribute to many of these areas where the child rights have been affected. That is why I'm going into the details of all of these. In my next slide, I'm talking about the child right to protection. Next slide, please. In this, I'm trying to show how, when we talk about child protection, we are talking about, the child's children who are not having a safe and happy childhood because they are prematurely gone into work, or they are forced to get married, or their mental health is affected. And lately we also see there's a lot of cyber crime when children get exposed to wrong platforms on the internet. And in several ways we know that the child's right to protection is affected. What does the data say? I have put it on the slide for you, and I will be sharing the slide with Rajiv Gandhi Institute, and they would be sharing it with you. So I will not want to go into too many numbers at this stage, but you must know that these are really big issues because several people are affected. If you just see, many of you may have heard of the term child line, which is like a supporting service or a complaints receiving service, which is available in all the states and the union territories, where the child line received 50% more calls during the same time this year and last year, because so many children, so many people were making calls, distress calls, saying that the child right to protection is as a major issue now. So, and then even if children are safe at home, as we may think that they are safe at home, you never know how their mental balance is, because this COVID has affected all of us. This news all the time saying that, it is here, it is there, it is in your next road, somebody known to you has died. All of this is affecting our mental health. And you never know how safe you are, because you are going outside, you are taking care of your hand hygiene, and you are taking care of your physical distancing. But then there may be how long will it take for a little gram of a virus to enter your nose or your nostrils? So it has been a very, very distressful thing, right, for all of us. So the mental health, especially affecting children and adolescents, we all know how all of us also went through our adolescent age, and we all know what changes that happened in us when we were, teenagers, and the kind of fear and anxiety and depression, or maybe some of us even have suicidal tendencies. I don't know. So we all have come through a lot of difficulties through an adolescent phase, and this mental space is highly affected by COVID. So we, as officers and duty bearers, we will all have a lot of work to do on this area with children and young people. In my next slide, I'm talking about education, and I'm going to spend in my next slide, please. I'm talking about education because education, or the right of a child when the child goes to school, bridges all other rights. How do you say that? In education or by schooling, we all get knowledge. We all get to learn about things in school and out of school. We are able to read newspapers. Our minds become more reflective. We are able to have critical thinking. We are able to, like we did in the last session, we are able to weigh the pros and cons of different things and make decisions. So child education, or the right to education, is a bridging right that brings all other rights. Because of that, you can argue for other rights. But then during COVID, what has happened? That none of the governments have really opened up schools for all classes. So there has been a closure of schools, which has affected 1.5 million schools, and 250 million children have been affected. So all these children are sitting in the house. They are trying to learn through digital platforms. They are trying to that's a bigger problem. I'm going to explain in my next slide. So a lot of changes have come, and this digital learning, or looking at your mobile and looking at TV or radio and reading your lessons through that has become a new normal because of COVID. But in this, I think the human touch, the smile of a teacher, or a pat on the shoulder, we all know how much it matters, right? If we got a pat from a teacher on one day, that becomes like our lifetime experience, right? Even now we remember, oh, that teacher was such a nice teacher. But these things are affecting the children now. They are not able to have these things. They are not able to play with their friends. They are not able to share their stories, share the dreams that they had the last night with their friends. So they're not able to play. All of this is affecting the child right to education. In the next slide, please. Yes.
Yes, this 50% of the digital learning is not procured by the children, because most of the children are from the poor background. They don't have smartphone and like that.
Yes, absolutely.
So,
I'm going to come to that myself. You just, preceded my thought on that. I'm coming to that very shortly. As you've noticed in the earlier slides, I have talked about the right and also the response of the government. So in this also, I'm just going to tell you the response of the government, and then we'll go to the issue. Here, I've just put, some of the interventions that Government of India has put to make to let children continue to learn. Basically, there is a platform called Diksha platform. Then there is the Swayam Prabha TV channel. There are 5 channels now. Then there are also TV channels that each state government has. Some of the state governments have their own TV channels for education. Then there is this e-Patashala, in which digital books are available. So many audiovisual materials are loaded. So many students are, also covered by open learning, and several new activities have been suggested for them to keep them engaged. And in several states, the teachers have gone home personally to deliver textbooks. All of these are the response of the government in terms of, COVID time. In the next slide, I'm showing you something interesting also that some governments are doing. Thank you. We in UNICEF, we work in 17 states only. We don't work in all the states. For the northeastern states, our Assam state office takes, programming for the northeastern states. In some of these states, there have been some very, very interesting, innovative ways of continuing a child's right to education in this difficult time of COVID. You know, in Chhattisgarh, there were these loudspeaker schools and motorbike schools where teachers just went on the motorbike and then hand delivered. And then they also set up loudspeakers in villages. So, you know, it was like a broadcast and helped also adults to learn at the same time because, you know, it was just a loudspeaker that was giving lessons. Similarly, there are several examples I have put, but for want of time, I don't know whether I will be able to explain all of them to you. But I can explain one work that I myself did in Tamil Nadu, where, you know, the 10th standard exams were postponed, or and children did not know when the exams will be announced. You know, it was a lot of anxiety for children. So we actually gave a free call number through IVRS method, we call it. Children could, and government gave us the phone numbers of about 6,000 children who were going to write the public exams of class 10 public exams. So we just spread the word for children to call this number, which is a toll-free number. And when they called for every day for 30 days, we gave them messages that were very motivating for them and improved their emotional balance to become more confident to go and write the exam, and all of that happened. So, I'm coming back to, in the next slide, I'm coming to the point that our dear friend has just highlighted about the digital divide. Because on the one hand, we say that, you know, there are so many programs, there are so many ways in which we can reach out to the child. But the reality is that 8% of the households only have computer with internet facility in India. Can you imagine? Less than 10%, not even 10 people in 100 people have a computer with an internet facility in India. And the smartphone penetration, if you see, only 1 in 4 or 25% people have smartphones in India. 50% of them do not have very low bandwidth. So even if they have a smartphone, their internet does not allow them to work on these, you know, digital lessons. And one of the surveys taken in 2018, quite recent, it said that, you know, 16% of households receive only 1 to 8 hours of electricity daily. So if you don't even have an electricity, you know, how are you going to charge your phones? How are you going to be able to watch the television? How are you going to use the computer for learning and all of that? So this is a really difficult problem, on top of the fact that poor people, you know, cannot afford the data cost, right? And if there are more than one child, who will use the smartphone? Who will use the TV channel? Who will use the available facility in the house? So all of this becomes a huge problem. So there are problems related to availability. There are problems even if they are available. Can you access it? That's a problem. If you access it also, is it acceptable? For example, do we allow in a typical area like this that you see in the picture, do you think a girl child can just sit with her computer, laptop, or a mobile phone and be able to learn? Will that kind of village accept the girl to, you know, have her way as freely as a boy or as another person? So these are, you know, adaptable ways of doing things. It's really a problem still. I hope I have addressed your concern, sir. In the next slide, please. So going forward, I'm just going to show you a global picture also. You know, it is not; these are not specific only to India. This is a graph that shows 5 sets of bar graphs, right? The first one is about low-income countries. Second is lower middle income, upper middle income, high income, and globally, you know, at the averaged out. So in this, you see, how are governments able to reduce the risk of exclusion of students? Why? Because in many cases, since children are not going to school, there is very high likelihood that they will just drop out of school, right? Because in many cases, there are several limitations for children to go to school. And if the routine is lost, and if a child is already going to work, or the child is, you know, even got married and sent off to another village, all of these issues, how is the child, the likelihood of the child coming back to school is really difficult. So what are governments doing to reduce that risk of exclusion of students from schools? We find that, this is very interesting because you see the bars in the first block, that is a low income, and you compare it with the last but one block, high income countries. See the difference in the length of the bars. That tell you what governments can do in high income countries compared to low income countries. And very interestingly, if you see the green color of the bar, which says no measures are taken by the government for all children. If you see that in the low income countries, the green bar is really tall, which means the governments are not able to do anything, despite the fact that the risk to the child for enjoying the right to education is very high in these countries. So this is to say that, when there is a vulnerability, or when there is a crisis, or when there is an emergency or a disaster like COVID, a pandemic, which affects the poor countries more, the poor within those countries more. And we have to really, our hearts have to reach out to the last child first. So that is the idea. As NCC officers, I wanted to play on your mind, just like the last session. I'm trying to play a little bit with your, the moralistic framework of your mind, to put the last child first, the most vulnerable child first, to see if the poor child is able to get the facility. So that is where I think our service really matters. In the next slide, please. I'm moving on, where I'm saying, so when we are talking about the dropout, which we all know is more among adolescents than younger children, because the pressure for adolescents to help parents in the poor households is really high. So what we have been doing is, we thought, since school is really much more safer for children than to be left in the house, or in a poor house, or in a community where there is more scope for the child to go astray from education, and to other criminal or other behaviors. We were really working on school infrastructure. We were ensuring that there were enough schools for every village and all of that. Then, because of COVID, we moved to digital infrastructure. That is what we saw in the earlier slides, some examples of how Government of India and other states have been working with digital learning for children. Now, but it is very important for us to move to the intellectual infrastructure of the child. By all of this, is the child's brain growth positive? Is the child able to, get skills and competencies according to the age? And skills are very important, because by skills we mean life skills, or the 21st century skills we call, where it is important for the child to have good communication. It is important for the child to be self-aware. It is important for the child to know to work with others, cooperate with others. It is important for the child to say no, negotiation skills. So all of this make the mental or the intellectual framework of the child, and these then make the positive and mindset for the child, and the child becomes emotionally strong and solid, and does not have negative coping tendencies, or does not have depression, or does not think of ending life. All of that does not happen when the emotional infrastructure of the child is built very well. So these are things that we need to work when we're talking about adolescents and young people in our societies to whom we should serve. In my next slide, I will go into a little bit more detail. Any questions so far? Should we have a round of questions, or should I go ahead?
Please go ahead, ma'am.
Thank you. In the next slide, so we talk a little bit, a sort of a summary slide. This is to refresh what we have been talking so far. When we talk about adolescent children, especially, we are talking about. I told you a child means from birth up to 18 years. When we talk about adolescents, we talk up to the end of the teenage, which means the 19th age as well. So from 10 to 19 years, we call as adolescents. And when we talk about young people, we go up to 24 years. So when we're talking about the COVID impact on adolescents, we have seen that the typical school support since children are not going to school, since young people are not, meeting with friends, this has really affected their mental clock. Because there is no real, even for us when we are working from home, we can see how our mental clock differs, right? We tend to get up late because we don't have to prepare everything, keep some time for transport to office. All of that is saved now, so our mental clock also works differently. Similarly, so when the mental clock works differently, our routines get changed. When the routines get changed, our typical life changes. So if we are going to be, fine with that, it's fine, but it's not going to be fine for everybody, right? Typically, adolescents tend to sleep longer. They say that when the facial hair is growing for boys, adolescent boys tend to sleep longer. Now, if there is no school also, they may even sleep until afternoon or evening. So these are going to be affecting not only the adolescent child, but everybody in the family, right? We all, as parents, we know, if we have had adolescent children, we know how difficult it is to manage one child, and this is happening for so many children now. And similarly, the physical movement, they're not able to go out, they're not able to hang out with their friends. So this creates a new stress in the mind, both for boys and for girls, mind you, even though girls don't go out so much as boys or go out and play in the public playgrounds in the village. They do have, the desire to be, to breathe fresh air outside. So this physical movement really creates new stress in the adolescent's mind. Similarly, parental controls. A child who's spending time on say internet, on the computer, perhaps to learn. We don't know. So how does a parent really able to control that, or supervise that and monitor that the child is not going into dangerous zones on the computer? And getting into criminal activities, mostly they are susceptible to that, right? They are vulnerable. So without knowing, they might get addicted to certain games, or they may enter wrong sites. So it is not just about the amount of time that is spent on the computer or on the web spaces, but it is also the type of websites children and adolescents visit, and the quality of those websites. So parental controls become really important during COVID times. And many parents are going out for work. So how do they really monitor? That is another problem. Then there is also higher risk of abuse and interpersonal violence. There have been many cases across the country. Data shows that, at least about 1/3 of the families who were surveyed said that, children were facing more abuse in the house, verbal abuse or physical abuse or emotional abuse, and the interpersonal violence had increased between couples and also between parents and children. So this is because everybody is under stress, everybody is anxious. There is a traumatic experience going on in so many minds, and there is no money in the house. Then it becomes really, really much more of a problem, right? And all of these affect the adolescent's mind differently from an adult's mind, or from a mature person's mind. Sometimes, they tend to think that they are the problem, and then it becomes very negative in their own mindset. And this then creates other tendencies which are not good for the health of the child. Then there is also pressure to contribute to the family kitty when there is poverty. So children are pushed into labor. There are several negative coping mechanisms. Children may be taken along with parents in the new migration that is continued after COVID. Maybe children will also be taken with parents because anyway they are not going to school. So let them come and work with me. That attitude may be there. You would know more about it than in the Northeast than I would know about it in Tamil Nadu. Similarly, I will also highlight another point about how all of this, are actually reproducing and reinforcing the already hard inequalities that exist in our society. We have caste-based inequalities, we have poor and rich inequality, we have male-female inequality. So all of these inequalities, unfortunately, during COVID, they are getting exacerbated, or they are getting increased. And, we are reinforcing some of those inequalities. So it's a really hard time for us to be much more conscious of everybody's rights and everybody's freedoms. And then it is good that if we are able to encourage adolescents to not just be passive receivers of something that is happening around them, but to encourage them, motivate them to become change agents by themselves. I will give you an example of how beautifully they have worked in Kerala. I will bring that example in a later slide. In my next slide, please. So I think I will just skip this briefly because we have already seen how adolescent participation is important, right? This is really, we have to listen to the rights of the adolescent because they have their viewpoints. They have their ways of deciding what is best for them. So we also need to take them into consideration as change agents. In this, this is the example from Kerala. I'm sure you would be very interested to know more after also, and you can Google up or we can share more with you. There are some of these programs, state level programs in Kerala called, Our Responsibility to Children and Student Police Cadet. This is very similar to NCC, but this is the Student Police Cadet is led by police, and our responsibility to children is done by the social welfare department. So in this, what we found is, if you see the diagram on the side, the orange arrow going up, now if you see in Kerala, this started in 2010. And from then on, and it is a school-based and community-based program. So all schools almost are participating. In fact, they ask for the training, and then the police would go and provide the training in those schools. That is the way the program is organized. So now, as of now, there are 52,000 student police cadets, both boys and girls, who are available in Kerala, who are well trained to do several things, including emergency work. So they are available. So they are all full of life, and they really go out and reach out and do service for the needy. Now more than 1 lakh cadets are trained as change leaders, have been trained, and now there is a demand from so many schools which have not been covered yet in Kerala, and the enrollment is just increasing. And there is also it's not just for students but also for parents and the community, because they go and deal with so many other people. They are also interested and they also wanted to be part of the program, and they have been saying, how can we contribute to this program? So this basically has also shown very good results for several of these students. They are adolescent students, and their physical fitness has improved, their confidence levels have improved. They are really working towards a peaceful society around them. So looking at all of this, the Government of India has launched also this program at the national level. So I'm not sure whether it is available in the Northeast. You may have to go and find out. And if you need further, support on this, UNICEF will be happy to provide you and link you with Kerala to learn more about this. So I mentioned this to say that even during COVID time, these student police cadets, they contributed to preparing 1 lakh food packets in the first 2 or 3 months, just working in their own homes. And then they distributed the food and groceries in their neighborhood, and they contributed to the community kitchens, which were set up by the state government and local government. So children were not depressed in their houses. They were so positively engaged in this in the whole process, with proper, of course, safety and proper hygiene practices that were needed during COVID time. In my next slide, I just it's a summary sort of a slide in which I have already given you several examples of what UNICEF has done during the COVID. So to just sum up, we have been doing a lot of policy work with the national government as well as state governments where we are located to improve the services for health, nutrition, like I said, immunization, or child feeding, or getting digital learning properly in place, providing kits for those who cannot access computers, ensuring that the children are safe in protection homes, also institutionalized places, and disabled children. So all of these ways we have been supporting programs with government and also NGO partners to reach out to the to reach out to every child. And as I said, we always look at the last child first, in the sense that the most needy child, the services go out to them first. So that has been UNICEF's approach. And we also build capacity of the system, the departments, to be able to serve better during these times of crisis. We provide special capacity building for functionaries like Anganwadi workers or teachers and all of these, people who reach out. We also have done several rapid surveys and created evidence and knowledge products and situation reports to show the impact of COVID and prioritizing of services which needed to be done first, and influencing policy by sitting in committees, high-level committees of government, which decide the funds that will be available on special measures for COVID. So all of these work have been really top priority work for us. In some cases, we also did the pilot ourselves. For example, the student police cadet I showed you was a pilot that UNICEF supported. And we also have a program called Yuva. Yuva is basically a platform for young people. We work with young people to transform their lives through education, through skills building, through employment opportunity, and all of these activities. So UNICEF is all out there, because all of us have to be out there helping children and adolescents and young people. In the next slide, I will just leave the slide with you because it needs a little, I just have about 10 minutes time left. I also wanted to appreciate a discussion among ourselves. But this slide is a very simple one, though it looks very boxy around. It just explains, what is a conceptual framework for us to work with adolescents and young people. We have to understand that they are vulnerable. Girls are more vulnerable than boys. Young people are more vulnerable than older people. So keeping that in mind, we try to work around life skills. We try to work around supporting them to manage conflicts with good values and ethics. We ensure that proper services of the government reach them. All of this, that is what the different boxes talk to you about. So perhaps you can just look at it sometime in detail. It's just a framework for you to keep so that when you're working, you can just check the box. Okay, am I doing this? Is it my problem? And am I able to address this? So for that, I just put a, sort of a summary one there. So then my last slide, the next slide is my last slide, where I'm saying, yes, we have so many good policies. We know that there is a new education policy, there is a nutrition policy, there is a health policy, there is a child protection policy. There is a protection against cybercrime. There is a policy. There are policies and policies in India, and these policies also have laws. There are laws to avoid to eliminate child labor. There are laws to say that every child should be in school. We have these laws, but then there are also so many gaps. So how do we plug these gaps from policy to the expected outcome that all children, all adolescents, all young people should be able to live a full life, enjoying all their rights? I think the problem is mostly we are not able to map the issues exactly where the problem is. Sometimes even if we know where the problem is, we are not able to connect them, connect the problem with the solution. We are not able to do that many times because our policies and programs do not reach those people, and we are not able to empower them with skills, empower them with knowledge, empower them with livelihoods. We are not able to do that for all the people, even though we have several policies in place. So we need to have much more commitment in each of us as duty bearer, because many times we tend to say that, oh, the government did not do that. What is the government? We are all part of the government. So we have to take, each one of us can commit to a cause, and we can do it in our own small way. If governments can do big things, we can do small things very well, in fact, much better. And we need also, but we need to push the government to provide sustainable financing. If there are no funds provided for welfare schemes, how will the schemes work? So we need to ensure that enough schemes are funded well, so that we are able to reach the area where the scheme is most needed. and we have to ensure that our staff are able to provide delivery of services with good quality to all people. So that is my last line. I just have a thank you slide with a message, where the message is that please, to the next slide, please. Many things we need can wait. I'm just showing you a picture. During COVID time, people are wearing masks and they are waiting probably for their rations, or perhaps a special delivery of food, or I don't know what, for what they are so anxiously waiting. It is really sad to see such a long queue of people waiting so anxiously for something with children. And, this is the status of our people. So like this, many of our things we do wait, and many of our needs perhaps can wait, but the child cannot wait. So we need to keep that in mind and ensure that the rights of every person is addressed by our moralistic and ethical behaviors. So I stop there.